Welcome again to all, and thank you for making the time to be able to join us for our webinar today, The Voices of Siblings, Tools We Can Use to Help Support Siblings of Children with Mental Health Challenges. My name is Bryn Asquith, and I'm the Program Manager at BC Children's Kelty Mental Health Resource Center. My pronouns are she, her. And before we begin, I'd like to acknowledge with respect and gratitude that the BC Children's Kelty Mental Health Resource Center is located on the unceded, traditional, and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations, and that these lands were and always will be Indigenous lands. I'd like to take a moment and share with you a little bit about the Kelty Center and our services that we offer. We are a provincial mental health and substance use resource center for parents and caregivers of children up to age 24. And we help families across the province navigate the mental health system. We also connect them to peer support from trained Family Smart parent peer support workers. And we also connect families to free resources and tools, including things such as our Where You Are podcast, webinars, and more, all of which you'll find on our website, keltymentalhealth.ca, of which one of my colleagues will also be dropping that link in the chat. Our webinar today is presented in collaboration with BC Children's Sibling Support Center. The Sibling Support Center at BC Children's and Women's Hospital is a free support service for families who are on campus while their child is receiving care. The center provides short sibling supports with play in a creative, volunteer-supported setting. And the center also provides free access to sibling-specific resources. A few housekeeping notes as well for today. As noted on the first slide, and again here, attendees are automatically muted and cameras are turned off. For any questions today, we will have a dedicated question and answer session after the main presentation. So please submit questions for the speakers through the Q&A function via Zoom. There has been an option enabled where you can vote for questions that you want to be answered to kind of move them up the chain, also known as the upvoting feature. If you are experiencing any technical issues, for example, your sound is not working, or you have general comments for our team who are working so hard in the background to support this webinar, please submit these through the chat function. And again, have questions be submitted via the Q&A feature. At the end of the webinar, a survey will pop up. We ask that you complete this survey because it really helps us to improve future webinars that we have at the Kelty Center for parents and caregivers and other participants like yourselves. Please note the webinar is also being recorded. My colleague will drop the link in the chat multiple times throughout the webinar today so you can find the recording. And again, it'll be made available at keltymentalhealth.ca/events. For this webinar, please note that the information in it applies to the context of British Columbia. So if you are in another jurisdiction or area and joining us from another location, please consult your local health authorities for further information and resources that might be specific to supporting the voices of siblings in those areas and regions. And now to introduce our speaker, Emily Dimling. Emily is a certified child life specialist currently practicing at BC Children's Hospital. She was born and raised in Ontario in the small town of Windsor. There, she graduated from her undergraduate degree in developmental psychology with a thesis in mindfulness and youth. Following this, she received her master's degree in child life and psychosocial care at McMaster University. Emily, thanks so much for spending the time with us today on this webinar and connecting with our participants. Over to you.
Awesome. Thank you so much. It's great to be here today to talk to everybody about this topic that I think is so important. I'm going to jump right into it. And I'd like to start with another land acknowledgement. I know we just did one, but I like to do that when I'm speaking specifically, just to because of how grateful we are to be on this land. So again, we do acknowledge that the land we work and live on is situated on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nation, and we're grateful for the opportunity to do so. I'm very happy to be here. So, to start, I wanted to talk a little bit about my role. Bryn just so kindly introduced me and a little bit of my background, but I just wanted to talk about what a child life specialist is, just to get into that, and how we support siblings, and how we can support your siblings today, and how I can hopefully be of help with that. So, my role, I work at the Children's Hospital, and our role is to help provide a little bit of relief in the impacts of injury and trauma in the hospital. So we're trained with development and psychological disciplinary approaches that help with the family care satisfaction and overall experience of our families here at the hospital. Child life specialists are actually situated throughout not just only hospital, but in clinic settings, in sibling settings. So some little types of developmental knowledge that we acquire, we help translate into coping skills, which is what we'll talk about today. Some interventions that you might see a child life specialist provide include development of positive coping skills, procedural preparation and support. We do a lot of school and peer reintegration into the community. We help to provide therapeutic play and services in the hospital. That might be medical play, it might be some therapeutic play or working through trauma. And one that is in relation to our conversation today about siblings in this capacity is sibling and caregiver education. Okay, so to start, I just want to um, start by outlining the three most common types of siblings that we see in our centers and in our hospital and in the Kelty Center. So specifically today, we're talking about our youth struggling with mental health and those siblings. Other siblings that we see in certain clinics include children with chronic illness and siblings of hospitalized youth. But today we're going to focus on youth, the siblings of youth struggling with mental health. And there is something that all of these siblings do have in common, and that is that potentially siblings can feel overshadowed. And our focus and your as parents, your focus as caregivers is to provide the best support that you can, especially with your children who are undergoing something maybe traumatic, maybe a new diagnosis of mental health. And so oftentimes our siblings can get kind of put to the back burner. So the question is, how can we support these siblings and talk to them about their siblings when they really need that, when they need that from us? So in this presentation, we're going to be discussing some strategies, including language to use when we're talking to our siblings about this, and some developmental pieces of your children so that you can help them understand better, make connections, and some resources that you can use. So to start, I wanted to highlight that one of the most important things to note is that you know your children best. I always say that you are the expert in your children and your child's care. So you can kind of get a sense of their emotional needs, their social needs. So this is just an outline to help kind of recognize those signs of when your children might need some extra support. So, children and youth experience stress or when they undergo a stressful experience. That could be a change in routine. That could be maybe a bad grade. That could be your one child getting a mental health diagnosis and that sibling is seeing the change in the household and seeing how things are different. These can all lead to social and emotional responses. So, a really nice quote here that I have on the screen: the social emotional needs of siblings can often be unrecognized or are just unable to be prioritized by parents and other family members when these stressful events occur. And so I wanted to highlight some ideas and some certain emotions, physical and emotional, that you might see those siblings kind of express when they're needing some extra support. Some of those include acting out, becoming aggressive in situations when they don't get their way. Maybe their eating habits are altered. You might notice that a sibling is eating less or eating more. Sometimes you might find that the sibling is maybe more withdrawn, not interacting with their sibling as much. Maybe you find that there's some jealousy of the sibling who has a mental health diagnosis and they're getting a little bit more attention at the time. You might see some jealousy there, some nightmares, feeling scared. So those are all some ideas in which you might kind of see from those kids at that time. With that being said, the ages and stages of kids is so important to kind of have an idea of because it helps you to understand where your child is at and how you can best support them. So, we're going to get into a little bit of science and psychology here, just very briefly. Um, if you haven't heard of Piaget, he is a Swedish psychologist and he created the developmental cognitive theory of child development. So, these stages each go through each stage and stages kind of outline what strategies that you can use to talk to your children about their siblings' diagnosis. So we're going to start by going through all of the stages, and then we'll go over some strategies that you can use with your children in those age groups. Something to note about these cognitive processes is that they do develop over time, just like stages of your child's physical development. And another piece to note too is that they are updated and they can be changed depending on the environment that they live in. So depending on your household, depending on if they have an older or a younger sibling, all of these things are important to take into account. And I'm going to come back to these stages too when we talk a little bit more about resources. So to start, we have our first stage. It's 0 to 2 years old. It is our sensory motor stage. So in this stage, the child is learning through their environment. They're learning mostly through play. Play is our universal language. We use that a lot in child life practice too, for kids to work out their emotions, to express themselves, and to learn about things. It's the main language that we use with kids. And so uh, kids at this age are exploring through their environment. They're learning through their environment. And so they try their behaviors to receive results, and they do a lot of cause and effect. So I have a picture of Miss Rachel up on the screen for this age group because if you haven't heard of Miss Rachel, she is a toddler superstar, and you should go look her up after this. Some parents kind of might find her a little bit annoying with her high voice, her hello, but she is brilliant at what she does because she uses those cause and effect behaviors to grasp children's attention. And it's really great for kids to learn new words, to learn actions. So it's a great example of that for kids. So these children at this age don't really have the thinking ability to think in that, complex mental health diagnosis capacity. So a lot of what you will do with them is it's really important to maintain a routine as much as you can. And we're going to talk about a little bit more about this later on. But using a routine is really important and really great for this age. And kind of being mindful within ourselves because we also have to take care of ourselves too, and being mindful that children at this age and all ages can really pick up on our emotions and our feelings. I have a really great example of that. I have a little cousin who's 1, and I'm from Ontario originally, and I went home recently, and he is learning just at this age, right through his environment, through understanding. He dropped a piece of food on the floor and put his hands up like this, and my cousin, who's his mother, would go, "Oh, touchdown. Like you've never done that before. Whoa." And everyone made this big reaction. And because of that reaction, my little cousin, threw his hands up like every 5 seconds. It was like, oh, if I do this, I'm going to get this reaction. So that's how these children are learning. And so not just with the physical point of putting your hands up, but he's also picking up on that excitement that we're giving him, right? So these kids can really pick up on that. So if you're feeling anxious or you're feeling angry, and maybe they can sense that there's some fighting happening or there's some things going on that's different than their normal everyday life, they can really pick up on that. And we'll talk about a little bit more about these strategies as well to help with that. The next stage is pre-operational. So if you have a child between 2 to 7 who's a sibling, this is kind of where their realm is at. So at this stage, kids start to grow from just using the physical world around them, just like your toddlers, but they begin to develop a more mental representation that's more than abstract way of thinking. And so when I say abstract, I mean an idea without the physical thing present. So they can think about things even if they're not there at this point. So for example, if you threw a ball and the ball rolled behind the TV, that child will recognize that the ball is still there. And so that's that age that they're at. Now, in this age, we see a lot of pretend play, and we do a lot of pretend play and medical play in a hospital setting or a clinic setting as well to help kids navigate through traumatic experiences and to help prepare them for experiences. So, this is a great age to start using play to talk about things. Um, they still struggle to understand another person's point of view. So maybe they're still having a bit of understanding and confusion if your other child has a mental health diagnosis and say is has OCD and is feeling like they need to perhaps check things more than once, that this child might not understand fully why this person has to do that or why their sibling has to do that. So they're not at that stage yet, but they can still talk about a person that's not in the room at this point. Um, Magical thinking is a really big component of this age. And when I say magical thinking, it's the belief and thoughts, actions, or rituals that can influence real world events. So the best way to describe magical thinking is to put it into an example. So I do have a great representation of magical thinking. Some examples might be I caused a thing to happen by thinking about it. So now that thing has happened. So their thinking is that what they thought in their head is actually going to happen. So if I ignore my symptoms, maybe they'll go away. Or if I avoid the thought, the bad things won't happen. These are all examples of magical thinking. So just like we see these in our kids with a mental health diagnosis that we could see, we do also see this in kids who are still growing and developing. They just might be in a different way. So it's very, very common to see that. It's like when you say the famous saying, "Don't step on the cracks, or you'll break your mother's back." That's a very common saying that I used to hear all the time as a child, and for a while there, I did stop stepping on the cracks because I believed in my magical thinking of my 7-year-old self that if I did that, something would happen to my mom. So these are kind of examples of this. A big one to mention of this is that siblings might often feel like it's their fault or something has happened if one of their siblings is admitted to the hospital for a mental health crisis, for example, and they had a fight previously. That child may think, oh, I caused this to happen. They're in the hospital because it's my fault. So it's really important to know how to communicate with your children in a way that it leaves open conversation and for them to be able to kind of grasp those misconceptions and be more at terms with that and have a better understanding. So we have 7 to 11 years old, and this is our concrete operational stage. At this stage, children and youth have a more concrete sense of conversation and they can solve problems in a more conversational capacity. So with this stage comes more problem solving skills and the ability to understand that things are reversible and that there are different perspectives so that other people have different perspectives. Um, this is a great example at this stage of why offering space for your children, especially those siblings when they need someone to talk to about things, is so important because they can have a better sense of what is going on, and leaving that kind of door open to have some check-ins with those children are important for them to clear up misconceptions about what they may think is happening versus what's actually happening, and you can be honest as you can uh, to help provide that for them. Formal operation theory. This is the 11 to adulthood. So this is kind of where we're at now as adults. At this stage, the youth 11 and up, they can think more abstractly and they can test their hypothesis and various possibilities. So the abstract concepts that they're thinking of, they're not limited to time and people, and they understand that it might not exist. So this is kind of where fantasies come into play, the what ifs. Hypothetical deductive reasoning skills are a bit more prominent in this age range. And, these days it is very easy to look up things on the internet and to look up from, Google or Wiki or anything like that. And so it's so easy for teens to get information when they are curious about something. And some of the time it is correct information, but there is a possibility that some information might not be so correct or may overstate something. So that's a really great way to have conversation with teenagers, especially, is to kind of look up things together or rule out those things that, might not necessarily be the case for your family specifically. So with the ages and stages that we just went through, I wanted to kind of pair some strategies and how to talk to your siblings, because I did mention in most of those slides, actually, how important it is to be able to communicate with your children and siblings, especially about, as much as you can about what is going on. So the 5 C's are a common approach that we can use to talk about mental health with our children, with our siblings. Um, so we typically use this approach at the pre-operational concrete stage, but you can use this approach with any of the stages. It's a great way to clarify things, and it's great that they're asking questions. It's really important to remember because I know that I am sure that it can be quite intimidating for a sibling to ask you a question. That's just how they're learning. And if you don't know the answer to something, that's totally okay. And I think sometimes a lot of kids will feel comfort in you not knowing the answer sometimes too, and offering to go get the answer with them. There are times in my practice where a patient has asked me a question about something very medical that I don't know the answer to. And so my usual response is, oh, you know what? That's a really good question that you're asking. I don't actually know the answer to that either. Why don't we look for the answer together? Or why don't we go ask the doctor together? Or I can get the answer and come back to you. So if you don't know the answer to something and you don't know if a child is asking you about their sibling's medication, for example, and you don't exactly know the answer yet, that's okay. Offering that space to be honest and open with each other is a great way to instill trust in your kids. So the 5 C's all include, can I catch it? Did I cause it? Can I cure it? Who will care for me? And how can I connect with them? So, a common one that we see is, did I cause it? And we talked a little bit about this earlier with our stages there. Some kids have that magical thinking at certain ages, in that kind of school age. And two big ones is, can I catch it and can I cause it? So, it's really nice to have maybe even scheduling every 2 weeks. A time where you can sit down and have a check-in with your children who are siblings, and just having some time with them to go over some things about that. Can I catch it? My sibling, for example, you might have a daughter that says, my sibling, she has OCD and she repeats herself all the time. Am I going to catch that? Like, am I going to have that too? So it's really important to clear those up and those misconceptions so that your child has a better understanding and they can be siblings together and interact together in the capacity of who they both are. It's also those children's learning of who they are as a person, because sometimes they do get overshadowed by your child with a mental health diagnosis because it's so important that they're getting the care that they need. And with that, sometimes siblings do kind of lose their sense of self. So answering these questions will help them gain that like independence that they need to know what's going on within the household, which is great. And how can I connect with them? That's another one that is a great one to use for making some sibling bonding activities and doing things that will kind of instill that family connection, because it's so important and it's such a big part of your family's environment. Okay. So we've talked about some ages and stages of what we think of what we have for all our children and our siblings, and how we can help them to best prepare them with coping strategies. So now we're going to talk about some helpful strategies on top of how to talk to your children about that. So I have some things written down here that I think are a great way to start. One of them is, as much as you can, as we talked about with our toddlers, is to keep a routine as much as possible. So we wake up, we still go to school, we brush our teeth, we come home, we have dinner, whatever routine that fits your household. Try to maintain that routine as much as possible, because it creates some normalcy, not only for your child who's a sibling, but also for your child who has a mental health diagnosis. Um, Routine and consistency is a big part of growing up and a big part of their day. So trying to maintain that as much as you can, to help your child feel more involved in care. So this is just meaning maybe the sibling is feeling a little bit left out if there's a daily therapy session that their sibling is attending. So maybe they can feel more involved by, hey, do you want to come for a car ride and we're going to go drop off your brother? You can come with us. So helping them feel involved in their care, even whatever capacity is safe to do so. Like I said before, I just wanted to reiterate it. Kids ask questions, and that's okay. It's just being as honest as you can and utilizing what your child can understand. So just using the information as honestly as you can, and talking with them as with about the diagnosis as much as you can. The circle of control. This is an activity. It involves some circles. I have a picture of it on the next screen, but it's a great activity to use with any age, and it just gives kids an idea of who they are as a person and the things that they can control and that they can't. Because sometimes siblings experience some anxiety with um, change of routine and change of their household, and the almost like the loss of their sibling that they knew before, and now having that new person that they may or may not know anymore, and them kind of recognizing that it's still the same person. So having those kind of chats and having this circle of control will be a really great activity to do, and I'll show you a picture of that. In just a minute. And lastly, seeking out extra supports if you need. Um, it's great to have extra supports, peer supports, relationship supports, sibling groups and sibling support center. Those are all great examples of some extra supports that can be sought out. We do have some great supports later in this presentation. So you'll have some ones that you can kind of jot down, but it's all really important that your children who are siblings also have their own kind of life, that they can still do things outside of the family and have peer connections that are important, just like your child who is also going through their mental health diagnosis. It's really important for siblings as well. This is the circle of control. This is I love this picture. I love a good diagram, I guess, if you will. So I always have these extra pictures up, but in the circle, there are things that they can control, that your children can control. And so in there, it says, learning from my mistakes, taking care of myself, who my friends are, they can choose that, asking for help. And then outside the circle, there is things I can't control, and that's things like the weather, being sick. Um, can't control when others are kind. They can't control what other people think. And they can't control what other people say. So I think this is a really great outline. I really like this picture because it gives kids an idea of what they could put in their control circle and what they put on the outside of their circle, and that you can even work with them on thinking that maybe they can't control what time that they have to go to this appointment, or your sibling can't control not going to an appointment with their sibling, but they have to go to school, things like that. And they can't control what their sibling says or does, but they can control what they say or do. Things like that are helpful for them to gain their sense of control. Okay, so I'm going to introduce Jasmine. She is in our sibling support center. She is about to share a sibling story from a lived experience, and so I'm going to pass it off to her. I think this is a really impactful piece of the presentation because it kind of outlines a lived experience of a sibling with a sibling who has a mental health diagnosis. So kind of gives you an idea, and it highlights beautifully their journey. So I'm going to pass it off to you, Jasmine.
Thank you so much, Emily, for your warm introduction. I am truly honored to be able to share this siblings' lived experience. As Emily mentioned, lived experience is so powerful. I will be reading the sibling lived experience out loud, and it will be written on the following slides. So please feel free to sit back and listen or read along with me. With sharing something, we do recognize that this may resonate with caregivers quite deeply and may have a triggering effect. Please take time to take care of yourself and practice self-care in whatever way feels right for you. On those notes, I will begin. Next slide. Okay. My sister was diagnosed with bipolar disorder before I could remember. I didn't understand the term as a child, but I knew it consumed my parents' lives and affected our entire family. New to Canada, my parents were learning the language, adapting to the culture, and navigating a complex healthcare system to support my sister, unintentionally centering our lives around her illness. As a sibling, I sensed my parents had too much to handle, so I minimized my needs to avoid burdening them. It wasn't until I started experiencing daily panic attacks that I started attending counseling and some sessions with my parents and found a way to communicate with them what my experience had been. Because I had made myself as low maintenance as possible and they had been so occupied with my sister, It had not even occurred to them that I could be going through so much. Through some family counseling sessions, I was able to develop strategies to help me communicate more effectively with my parents, which helped significantly. Their continuous validation of my struggles and experiences was so crucial. Just knowing that I could go to them with my troubles and find support, as well as unlearning, comparing what I was going through to my sister's experience. Seeing my parents also try their best and give themselves grace throughout was quite healing and has influenced so much of my self-perception and the way I regard myself as an adult, treating myself with the same patience that my parents treated themselves with when they made a mistake. The processes for supporting a child with mental illness and for being a parent are not easy and can't be done perfectly 100% of the time. So making space for mistakes is essential. Thank you very much.
Thank you so much, Jasmine. That was a amazing quote, and we're really grateful that that sibling was able to share that with us, because that's probably not super easy to do. So it's a great kind of recognizing of kind of the impact that siblings can experience in any capacity, not just with their sibling of mental health, it could be medical, but it kind of highlights the importance of communication and the importance of making those check-in times for your kids and how to talk to kids and recognizing that importance. So it's a beautiful kind of sentiment to that. Moving to sibling connections on that note, kids are still kids and teens are still teens. So we want to make, we want to make their connection still a part of their daily environment and their daily lives. Siblings do have a really nice and important connection, and it's a part of how they grow up. So I have some ideas written down here that I find are really helpful in providing that sibling connection activity for them to still bond, and for your family to still bond. Some ideas include things like sibling memory making activities. And when I say memory making, I just mean things that are impactful for your family. So maybe that means, I have a picture of bracelets there. Maybe your siblings want to make matching bracelets. This is also going back to the 5 C's that we talked about. So how can I connect? How can I connect with my siblings? And memory making activities are a great way for siblings to connect with each other, and for you to keep those expressions going. So making bracelets, maybe it means I have 2 sisters, and I used to have picnics downstairs every other Friday. We would have dinner downstairs in the living room. So things like that, those kinds of memory activities. The second one is family bonding time. And this is just highlighted here so that you are given the chance as caregivers to, bond with both siblings at the same time. Because sometimes when we go to appointments with one child with our mental health diagnosis, the other sibling is left behind, and it's a really great way for them to do something together with both of you, to have that bonding experience. So family bonding time is really great. And rule setting is another one that can really strengthen connections. Rule setting, even but not the same rule setting. I put that there because, for example, if you have, say, a 7-year-old and a 15-year-old, you wouldn't give them the same necessarily boundaries or rules, but I think it's a great idea to keep things as even as you can, because there is that kind of emotional piece of jealousy that gets involved. Say you're spending a lot more time with your child who has a mental health diagnosis when they first get diagnosed, and that other sibling is experiencing some jealousy and experiencing those symptoms and emotions. Trying to set some even rules and guidelines and making things the same for both your children can be really helpful with evening that out. So, for example, you wouldn't make a bedtime for a 7-year-old and a 15-year-old the same. You would probably, the 7-year-old would go to bed a little bit earlier than the 15-year-old, but you could say, your child who's a teenager and has a mental health diagnosis and is feeling specifically very anxious with generalized anxiety, and they go out with friends and they stay out a little bit later because that's something that they really needed to do to help help them cope in the moment, then maybe your other child who is a sibling is like, well, why can't I go out late and stay out till that late? This is a great idea of rule setting. So for example, okay, well, you know what? Your sister really needed to go out with some friends tonight. It's really helping her to feel better today. But why don't we plan for next week for you to go out and we can have a late night together? So kind of setting those even rules and boundaries, but not the same. So number 4 is fostering relationships. And this is a really important one. I think specifically this is really important, peer relationships. So this can be done with books, movies, peer groups. So I have a few peer groups right now. Of course, the Sibling Support Center at our hospital is a great opportunity for other siblings to meet other siblings. There's also the Sibling Support Project that you can look up online, and that has some great online peer groups as well for siblings specifically, and also just their everyday life peer groups. So when I say everyday life, I mean maybe a sports team that they try out for, or they do a drama workshop or something. Anything that they can do to kind of normalize their lives and experiences is a great way for them to build that peer connection. And there's actually research that has shown that peer connection with other children with similar stressors in their lives. So maybe, some similar stressors with another sibling who has a mental health diagnosis or a hospitalized child. They have, it's shown that peer groups increase protective factors and actually improves their quality of life and reduces social isolation. So there's been research that shows that. Okay, and this is a beautiful collage. I love my diagrams from the Holland Bloorview Sibling Support Program. So I just put this up here because I think it's so empowering, and I just wanted to share it. It has some graphics, and it's a big collage. This is another great activity you guys could do together as a family. All your family's experiences are different from one another, but we all have that commonality among us, and so it's really interesting to have your own family story. And it also provides a bit of sense of self and sense of control for all the members of the family about who they are and who they are individually, but also as a family. So, um, one of them is, I hope my sibling can do the same thing as me. My sibling loves to go outside. She becomes friends with everybody. So making, their experiences their own, but also sharing positive things about the other. Okay, and now we are on to our resources piece of the presentation. So I'm going to pass it off to our family family and resource librarian and wonderful lady, Pamela.
Hi, thank you so much, Emily. And hi, welcome everyone. It's lovely to meet you here. I will be talking a bit about resources for people in BC. If you are joining us from outside of BC, please do contact your local health organization or your public library is a really good place to start. Librarians are great at helping find resources that may be hard to find immediately on the shelf. So first, as Emily mentioned, I am a librarian for patients and families, and I work in the family library at BC Children's and BC Women's. We do have a collection on supporting siblings, and I will get into that in a little bit. But we mail items for free anywhere in BC and the Yukon. So to contact us, you can email us, you can leave us a voicemail, let us know what you're looking for, or you're welcome to look at our catalog online, and we mail you the items you request, and then you just put them back in the prepaid mailer when you're done. I also do online searches for health information. Next, we have the Family Support Institute of BC. So if you are a parent or caregiver of a child with a disability, the FSI is a not-for-profit, and it's a family-to-family organization. So call and you can connect with a peer supporter who can help you with system navigation and also provide supports around helping the siblings in your family. Earlier in the webinar, Bryn introduced the Kelty Mental Health Resource Center and also mentioned the Sibling Support Center. And I'm going to touch on these very quickly in case you missed them. So you can contact or visit the website for the Kelty. They provide support navigating the mental health system and allow you to connect with peer support workers and access resources and tools, both to support the child who is working with a mental health diagnosis and with the siblings that are supporting them. And finally, if you do have a child that's receiving care on campus and you have siblings coming with you, the Sibling Support Center offers safe and short-term sibling support with play in a lovely creative setting. And so the links will be in the chat, and you can also get links to these in the thank you email that is forthcoming. So our collection spans the entire age range. So we have everything from board books for little babies to books for adults, families, caregivers. I'm featuring books here, but we also have games, CDs, and learning kits to support people with a variety of different learning styles. So I just wanted to highlight a few of these titles. The first, Manny's Mood Clouds, is a sibling voiced book on understanding and coping with some of the challenges that come with having a sibling with a mood disorder and finding ways to connect with that sibling. The next, Noah's Garden, that's that middle title, is about hospitalization, so coping when a sibling has a stay in care. We also have books for others that you may want to share. So we have, for example, a book on being a young carer, and that's when a child or youth has responsibility. Maybe they're translating for a family member, maybe they're helping with the care of the sibling in some way. So this really is a way to explain to others in your community, in your circle, the stresses that the siblings in your life might be feeling and how best to support them. We also have books to address emotional health, like this Monster Book of Feelings, and books for parents and caregivers. So this one, When Your Child Has a Chronic Medical Illness, while not specific to mental health concerns, does have a chapter on siblings, including talking about a new diagnosis and helping siblings manage emotions. That's it for me.
Amazing. Thank you, Pam. And I apologize, everyone. I'm in charge of the slides and I'm clearly not very tech savvy. So I apologize about that. But that does conclude our presentation today. I hope that you were able to take in some resources and some strategies about how you can best help our siblings who have a sibling with a mental health diagnosis. And I'm really grateful for that opportunity to be able to speak to you today.
Thank you so much, Emily, Jasmine, and Pam. So many insights, age-specific strategies, and great resources mentioned for parents and caregivers to support their child who is a sibling. So thank you so much. I have to say, your suggestions around tips for building connection between siblings and then also with peers and the real positive impacts that can have on your child's well-being is something that really stuck out for me. But what I wanted to do with our approximately 15 minutes left in the webinar today is open up the Q&A portion of our conversation. And so just a reminder that questions for speakers can be submitted through the Q&A feature. If you're on a desktop, typically found at the bottom of your Zoom screen. And joining our Q&A session, we also have Rhiannon Satherley, manager of the Sibling Support Center and Services at BC Children's Hospital. And then Jasmine will be joining background as well, and who you met earlier, and is a coordinator of the volunteer resources at the Sibling Support Center as well. So very appreciative to have you both joining Emily and Pam as a panel together to answer questions from our webinar participants today. So I'm going to go ahead and moderate and read out the questions that we've received in the chat so far. There may be others coming. So let's start with the first one. So it reads, how can I know if my child needs support? They tell me they are fine and don't want to talk. Emily, do you mind starting us off?
Yeah, that's a really good question because it's more common than you would think. So I hope that this helps to know that this is a very common response of a lot of siblings that say that they're fine or they're doing fine, especially depending on their age. But you want to be able to trust your kids because your kids will be able to trust you. So you take them at face value if they're saying they're okay, but I do think it's a great way to start would be maybe to start by doing some family one of those family connection kind of topics that we talked about, and perhaps starting along those lines and building that opportunity to have conversations, having those opportunities to have open discussions about it, or even just start the conversation might lead your child to better express themselves in that sense. Um, to ask questions that they might want to ask. But it's a very common response for some siblings to feel a bit stoic, especially if they're not really quite understanding fully what's going on, especially like those expressions that we've talked about. But yeah, leaving that space open for communication is really important and kind of meeting them where they're at. Hopefully they will come to you when they have a question once you leave that space open, if that makes sense. I hope this helps.
Thanks so much, Emily. Anything else from anyone on the panel to add to that? Okay. I'll move along to the next question. How can I even start talking to my kids about their brother's diagnosis? I'm so overwhelmed in even knowing where to start. Emily, maybe if you want to just jump in on some strategies there. Thanks.
Yeah, totally. It's a really great question. And so I want to start by saying that y as parents and caregivers, it's it's a tough conversation to have, and you have to give yourself a little bit of grace. So I want to refer back to that lovely lived experience quote that we left earlier, and that sibling actually noticed when their parents gave themselves grace when they're feeling overwhelmed. So no, acknowledging that within yourself is really important because you're doing a great job just what you're doing right now, being able to attend these sessions, and it's not an easy topic of conversation. And so I totally, and not everybody is in that same boat, but we all have that common ability. So I really appreciate you asking that question because it isn't easy. So being kind to yourself first and foremost, and taking those deep breaths and remembering that it's okay if you don't know all the answers to something, because actually our kids want us, like they feel that trusting connection even if we're a bit vulnerable ourselves. So to begin talking about something, I like I mentioned earlier, I always like to start when I'm in practice by kind of meeting them where they're at. So if they're acting a little bit stoic, then maybe I kind of am a little bit slower to approach conversation in that capacity. Maybe I start with something a little bit fun. So we do like a family movie night or something, and then later we talk about that. Or if you're in a car ride with just you and that sibling, can be a great way to just express that if they have any questions, that we can talk about it using those 5 C's that we talked about. And I believe that the slides will be available so you can go back and refer to those 5 C's, talking about how this, they didn't cause this to happen. Sometimes, some kids get different diagnoses, and that you didn't doesn't mean that you caused that. Um, Using those 5 C's are really, really helpful for kids to grasp an understanding. But I think most importantly is being kind to yourself, acknowledging where you're at, and meeting that sibling where they're at, and that child where they're at, but also using the time with that sibling to be open and honest communication.
Thanks so much, Emily. Any
I
other
think,
comments?
yeah, I
Megan?
just wanted to share, and thank you for having me on your panel. I wanted to share that, in our interactions with families at the door at the Sibling Support Center, where you can be so overwhelmed by the journey through healthcare, that those resources that Pam shared from the library are so easily accessible and also at an age appropriate stage. The picture books, the stories, they're relatable. You can talk through it. And the more you talk through things with children, the more they open up and the more you learn together. So the fact that there's resource books and videos and graphic novels, depending on the ages and stages that Emily talked about,
to use those resources really empowers you to feel more confident to have these conversations with siblings and allows them that free space to ask questions as you move through those picture books. So really lean on those books if you can, because they really open up conversations between you and your children.
Rhiannon, that's a great point. I was just thinking that that's brilliant to put in there. Books. I love book resources. If you're not feeling comfortable to share, start that conversation, perhaps a book would be a great option for you at the library. There's tons of those resources available to you. So that's a great point to make about that.
Thanks so much to you both. Focusing in on the next question. I want to get my kids some supports, but don't know who to talk to. Where should I go to get counseling or connect to counseling resources?
That's a great question. Oftentimes we get that a lot too as child life specialists. How can I help my child cope? Where can I get my psychologist? So the first thing that I will say is that the Kelty Center does have a peer support person, and there's going to be a link to that email in the chat. So you can reach out to the Kelty Center directly to access some of those supports. Another great resource would be, I know it's so hard to find a doctor in Vancouver right now or an NP, but anybody that you see, a family doctor or general practitioner, can refer you as well with a referral if your sibling needs some extra support in that capacity with just coping in general. But those are the two ways that I would start looking for that support.
Feedback from others? Great. Thanks, Emily, so much for highlighting or spotlighting the Kelty Center for that and the peer support work of the trained peer support workers. And the other thing I'll share is that when you connect in, whether it be through email or toll-free phone, dropping in person, or via Zoom chat with the Kelty Center, they can also connect you to low-cost counseling options as well, if that's something that's appropriate for your family. So just wanted to share that resource. Okay, next question. My kids are frustrated and embarrassed by their brother around their friends. How do I build their confidence to talk to their friend groups about their brother? And maybe some examples on language on how to do this.
That's a great question as well. Especially at the age where kids become embarrassed quite easily. Like, when we used to be embarrassed at our parents for coming with us to something, for example, in that capacity. This is a different sense, but it's a great question because it's probably pretty common, especially in the school setting, if your children go to the same school. So what I would say to that is, again, I'm going to go back. I know I've used this a lot, but going back to the communication, and maybe it's something that can be done by starting the discussion, talking about any misconceptions that could be cleared up, because maybe that sibling has a bit of misconceptions about how they are perceived by their peers or other peers. So I would really encourage that sibling to perhaps maybe have a conversation with their friends about it, and using that language that is comfortable for them. So it can just be we call it the elevator pitch, if that makes sense. So kids can come up with a elevator pitch, a quick few lines that they can say. If they ask about their sibling's diagnosis and they say, oh, why are they over there in the corner? Or why are they doing this? Your sibling can have an elevator pitch that they can practice, if that makes them feel more comfortable, that they can say. So usually an elevator pitch starts with a intro line, just saying, oh, my brother or sister is actually has a mental health diagnosis, and that can be all they say. Or if they'd like, they can name the mental health diagnosis, whatever they prefer. My brother or sister has bipolar disorder. And then the second line is sometimes they get angrier than most people get, and they usually like to do a few laps around the block to calm themselves down. And then the last line is usually an ending. So you say they're doing great though, and they just like to hang out with us if that's okay, or they're doing great now, thanks for asking. So that's kind of like your basic elevator pitch. So I would encourage maybe siblings, if they're having a hard time expressing that to their friends, to maybe come up with an elevator pitch that they are comfortable with sharing with their friends, if their friends are curious about it. And in terms of being embarrassed to hang out with them, that can come from a little bit of that emotional piece that we talked about in the very earlier slides of recognizing those signs. It can come from confusion. It could come from misconceptions, and it can come from a little bit of jealousy, right? From having, a lot of focus on our child with the mental health diagnosis. So recognizing those signs is really great that you've already done that and recognized that. And now it's just about kind of coming up with some solutions with that sibling together. Maybe you guys can sit down and have a conversation about it. Start by, checking in, saying, your brother or your sister would really like to hang out with you. And I've noticed that you seem a little bit embarrassed. Can you tell me a little bit about why that might be? Or is there something that I can do to help support you, that we can come up with a solution together? So offering to be that support for them emotionally, when they're navigating their peer group in their own lives, right? Because they do have their own lives as well. That was a really big spiel about that, but I hope that helps a little bit with kinds of things that you can do to help with that.
Thanks so much, Emily. Those were great examples as well. And so hopefully, some helpful tips for participants today. With just a few minutes left, we'll wrap things up. So I'd like to extend a very sincere thanks to Emily, Pam, Jasmine, and Rhiannon for being here today to connect with our webinar participants. Thank you to those of you who have made the time to join us today for the webinar. And thank you to my colleagues who have been working very hard on the back end to ensure that this has been a smooth webinar experience today for each of you. I also wanted to say, if you had additional questions or have additional questions after the webinar has completed, you can connect in with the Kelty Mental Health Resource Center. Our email is on the last slide. Oh, if we could just hop to the next slide, that'd be great. Our email is on the last slide being shared, and that's keltycenter@cw.bc.ca. And again, as I mentioned earlier, you can connect with us by toll-free phone 1-800-665-1822. You can also drop in person, and you can also connect with us to arrange an appointment via Zoom and connect in with our family peer support workers. I also wanted to share a reminder. Please fill out the survey that will pop up after the webinar closes. My colleague will also be putting a link to that in the chat. Again, this helps us inform how we can make the webinar experience as great for you as possible. And lastly, a recording of this webinar will be uploaded and shared on the Kelty site. And again, my colleague will be putting that link in the chat. And it will also be shared via our upcoming newsletter. So please make sure you head to the Kelty site, keltymentalhealth.ca, and sign up for our newsletter so you can also receive the recording that way should you choose, and share it with your personal or professional networks. Thanks so much to all for joining, and I hope you very much enjoy the rest of your day.